he's going to introduce himself.
He's good at introducing.
Really?
Sink or swim, just jump in.
All right, let's just start because time is of the essence and people are getting antsy. They want to get some stuff, to sink their teeth into some information. So we have two ladies on the panel, Dr. Elize and Master Christine, who are both doing integrative and nutritional work in the Bay Area. And I was, for some bizarre reason, elected to be the moderator of this. Usually I do my own talks. But it should be fun, and I would like to invite you, because your thing is already on the thing, and I'd like to, based on the request that we had, if you want to just say a few words about why and how you got into nutrition, but try and do it in less than 2 minutes.
Yeah. Well, I worked at Stanford Medical Center in heart surgery, cardiovascular surgery and research for many years, and what I found is that I no longer wanted to go on the track of physician's assistant. I was in the primary care associate track, and what I learned when I was teaching these patients at Stanford is that they loved the fact that I was listening to them and really paying attention to them, and also I was helping them basically to no longer have to have bypasses, because they were doing every 5 years, the research project showed a bypass without any, $50,000 in the 80s when I was there, without any education further beyond that about how to eat. So no one got information about how to eat or lifestyle. It was just 5 years later, I'm back, another bypass. And so that really changed my life. And then I met Lindsay Berkson, who is a very well known. How many of you know Lindsay Berkson? She wrote The Hormone Deception. I was offered a job with her at the clinic when I graduated. I have a degree in nutrition and in public health, and worked for many years at the clinic with her for 10 years, and that's what got me into what I'm going to talk about today, because I found that every person I worked with, the digestive system, of course, is the core of nutrition. Are we absorbing the food? How are we digesting it? Elimination, digestion, absorption is the core. And I had a clinic, written a book called Light Living, which is up there at the front, and it's been around the country, and the core aspect of it was people could not lose weight unless I looked at their entire, biochemical individuality. What food do they need to eat? So that's what I want to go into is, for example, with the weight loss, you all know, you're all very sophisticated folks here, that we all need a customized eating plan if we want to lose weight. It's not just a diet. But more importantly, what I found is many of these people had intestinal issues that were preventing them from losing weight. So I want to go into, how many of you heard me speak on the gut brain, which was in April? Okay, just a few of you. That's actually great, because then I can show some of the slides. I have wonderful slides on leaky gut syndrome and permeability, and why that causes so many times is at the root of autoimmune disorders like Hashimoto's thyroiditis. Every single case in the clinic, we found intestinal permeability, gut issues at the core. So number one about nutrition for me was actually witnessing the reversal of a lot of different problems having to do with looking at both the dietary factors, which we're going to talk about today. Obviously whole food, raw food is fantastic. The enzymes, you all know that in the whole foods. But more importantly, how is the digestive system functioning? So that's what I'm going to be focusing on. I'm going to show you this wonderful slideshow. I was just with Dr. Alex Vasquez, who is a physician and integrative GI specialist, and he did a seminar talking about all the cases that he was able to help reverse and shift based on using this particular GI assessment, as a core area. And I found that in the gut brain as well. So let me get started by just showing you a little bit. I'm sorry that the full screen mode, now it's coming on. Okay, so first of all, these are some indications. What this is I'm talking about a 3-day digestive stool analysis. How many of you have had a 3-day digestive analysis here? No one. Boy, that's great. I'm so glad I'm talking about this. How many of you get the annual stool swab that your general doctor gives you? You know, when you go to see your doctor, they give you a stool swab, right? What they're looking for is one element, which is occult blood. And if you have occult blood, guess what? You're already very far down the road in terms of, you know, conditions. So this is the test that I do at my office, and I've done for years with other physicians, is a 3-day collection. It's very accurate, but these are some of the indications of it. And what's really important is it identifies bacterial imbalances. And that's what Dr. Rosche was talking about, is if these pathogenic bacteria are in the gut in the form of a dysbiosis, it means that you're actually at risk of very specific autoimmune and inflammatory problems. So what we need to do is to know that there's billions of bacteria in the gut. You all know this, over 500 different species, and this test measures which species that you are low on and which species, you know, normally should be living there. So basically, it identifies living bacteria, it isolates it, you know, typing. I'm going to go over this a little bit more quickly because I have 2 different slideshows, but I love this because the latest client who came to me a week ago, she actually has had antibiotics in the last 5 years, 20 courses of antibiotics. And I'm sure you see people like that without ever being told about a probiotic. How many of you all know you should take a probiotic, give antibiotic? Everybody, right? Well, what happens is in standard medicine, what we do is we don't give out the probiotic in the office. So you have to, you know, again, like we're saying, it's very unreliable. So these superbugs develop, and what happens is she has these dysbiotic bacteria growing, and the bugs in the system are all overgrown, and it's leading to inflammation, skin conditions, Hashimoto's, lupus, you know, muscular dystrophy. I mean, Vasquez said that especially MS, MD, ALS, all have these bacteria, and I'm going to talk about what they are and what you can do about them. So, so basically, we're going to be looking at, in this particular test, you look at the normal flora, which no one ever looks at in standard medicine. What you do is you get a complete report, 15 pages of, you know, the normal flora. What amount of bifidus and lactobacillus do you have? And this normal flora helps you convert your vitamins, minerals, and also assimilate and helps your immunity so that, you know, your whole immune system is dependent on these bacteria being balanced. And then here we have these are some of the names of these severe bacteria that everyone with MS, and, you know, when they cultured it out, with the diseases I was talking about, inflammatory, autoimmune, you know, every disorder, especially skin disorders. He had one patient was in their 50s, whole body eczema, contact dermatitis, psoriasis. He put the person on whole foods nutrition, you know, obviously vitamin D3, got rid of this Klebsiella and this particular dysbiotic flora, and within 2 years, the person no longer had any skin issue. They had been in the hospital so many times. So remember, it's related to the skin, to every organ of the body. So what we're looking at is culturing this, looking at the roles of beneficial bacteria, training the immune system. They only attack pathogens. The beneficial bacteria produce biotin and vitamin K, facilitate absorption of calcium, magnesium, and iron, and affect the cellular changes that prevent intestinal permeability. That's really major. How many of you think you might have leaky gut or intestinal permeability? A number of people, yeah. So this is very important. It's like you need to get tested, or you need to use these particular nutrients that help you so that you can heal the gut junctions. And I talked about that extensively, you know, in my gut-brain talk. So I'm going to, the other thing that happens is bacterial translocation. It's actually bacteria that isn't just living in the gut. It starts to go into, it's especially like lymph, liver, spleen, blood, and brain. And that's why we have so many people with ADD, ADHD, autism, and all Asperger's. Everything is showing it originates in the gut with gut permeability. So So it's very important to see that. And also besides the different bacteria, and you get a range on that, it looks at, yeast overgrowth, candida, what foods you need to eat, and obviously parasitology. So this is just some information, but that's an inflammation. I think the most important thing that I find really important is that every person in our clinic who had arthritis, we looked at their inflammatory markers, and oftentimes there was a very high lysozyme or lactoferrin correlated with this serious dysbiotic bacteria. So it was not just one, it was actually that these particular elements show up way before you have inflammatory bowel disorder, way before somebody would have some type of malignancy. This would be elevated. They would have chronic inflammation. So this test measures it. And Vasquez was saying you can be totally asymptomatic, have low-grade inflammation, severe dysbiosis, severe bacterial overgrowth, no symptoms at all, and then by the time that it hits, which is what the medical system wants, it wants us to go, by the time you need that, you get that colonoscopy with a stool blood, those are called blood, you're already part of the $80 billion problem. So this is very cost-effective. And I have a sign-up sheet over there if you want to see me at the break or so. I'm going to have in my office these tests at wholesale cost, and if you want to test, because I really recommend everyone should look at this, how's my bacteria? Do I have permeability? What's my inflammation level? It's as important as getting our dental checkup. We don't realize, just like the teeth affect every organ, this is really crucial, and my clients come once a year, and we look at inflammation. Again, these are sort of technical things. I'm just going to go through them. I think this is the next part I want to talk about, and I have my own cases in my slideshow on that, which is that the secretory IgA, how many of you know what SIG-A is? How many of you have heard of SIG-A? Just a few. It's amazing. SIG-A is the first line of defense. It's the intestinal mucosa, which in Switzerland is measured first. What's going on with your mucosal immunity? So this is part of the test, is 80% of SIG-A, 80% of our immune system is in the GI tract. So there's an evaluation of that, and if that is off and your bacteria is off, then you are also most likely not making the types of products that when you're digesting your food, there's a lot that goes on. Then your essential fatty acids are off. Everything, all of the absorption of your nutrients depends on the bacteriology and the secretory IgA, and also the other factors that I'm going to be talking about here. So this is very important. SIG-A prevents binding of the antigens. It binds to antigens. So basically it stops foreign invaders. If you have permeability, which is the case in all inflammatory diseases, and you have these foreign invaders of bacteria, yeast, and parasites, viruses, food antigens, it goes into the blood, and then you have these inflammatory reactions. That's why all of the patients with Hashimoto's, once we healed their gut, we got the bacteria balanced, worked with their digestive enzymes, the whole system, whole foods diet, they are now no longer Hashimoto's patients. It was amazing to see this, over the time. So, and then again, SIG-A, prevents, it presents in a way, it's a healthy immune response. And here it shows the absorption issues with pancreatic insufficiency. So if the elastase is out of balance, it means, it's basically, there's something going on with pancreatic insufficiency, and it's not influenced by supplements or enzyme therapy. So this was very important. And then the other things, you do look at the microbes, the red blood count, the fecal pH, getting the pH down and working with it and increasing the fiber. So the goal was for us to also work with increasing fiber, working with the short-chain fatty acids, which are, how many of you know about the short-chain fatty acids? So, it's important in every way. Prevents colorectal cancer, which of course billions of dollars are spent every year on that. And it's the primary fuel for the colon, decreases pH, decreases inflammation, improves healing. So what this is part of is just, this is part of the test, the short-chain fatty acid assessment. And these are just all cultures that I'm not going to go into, but it does show that even people with severe diarrhea and so on have been helped in a very short time. So the take-home message for you is that this is state-of-the-art. It's not alternative testing, which we do maybe. You know, what I found is that if you can do it, it's very reasonable, and it is it's an international standard of practice in Switzerland, all over the world. Functional care. How is your digestive system functioning? Not, let's look and see if you have blood, and therefore you're already very, very ill. So this is a real key, you know, in terms of that. So what I'd like to do now is to go over the other part, which is this is going to be very interesting to you to see this, which is actually how much it costs. And that's why we talked about cost effectiveness. It costs $141 billion to address these issues, and the physicians I work with, which are all over the board, send people to me for the GI assessment because they're saying, you know, people have constipation, indigestion, GERD, whatever, and it never changes. And I do have to say that the nutrition is the core. You know, the stool test helps you to see what you need for your digestion, the functionality. Then you need to put into your body the foods that are right for your metabolic body type. So I really recommend metabolic typing, and, you know, but this is a tremendous key, is the cost. And then here is the conditions, you know, again, diabetes. We had a lot of diabetes cases with Dr. Vasquez that were reversed malabsorption. So many of my clients are losing weight because they are not absorbing their food. Skin conditions, depression is a key, fibromyalgia, food sensitivities, arthritis, allergies. You know, it goes on and on. And prevalence is one of the most common reasons, you know, people seek this advice. And this test here, which is state-of-the-art, and I'm working, you know, a lot with education, measures whether you have bacteria, fungi, or parasites, or enzyme insufficiencies, inflammation, and things like that. So I'm going to give you also some cases so that you could see that. And there's a very delicate bacterial balance in your GI tract. The flora, it's, you know, it shows you on this graph, it's, you know, billions of species, how much of each, you know, lactobacillus, bifidus, so many different species that we need to really be vital and healthy. So if the energy is low, and people say to me, you know, no matter what I eat, I can't lose weight, there's, you know, millions of factors, but this is certainly one of the things that you look at. And this lab, actually, the way that they do it, you test after taking any antifungals, even after taking the enzymes. I have people stop their digestive enzymes. And if you have this is the gut-brain connection. If you have an abnormal gut function, you're going to have alterations in behavior and emotion. So it's amazing how it affected my clients' sleep, how they felt, what their stress level was, the emotional state, depression, and I have, you know, a lot of information on that. So here's a fun one. The microbes made me eat it. So the more sugar that we eat, the more we are, you know, being kind of, we're sort of overdosing. The microbes actually they live on that. So all of these imbalance, like the yeast, the bacteria, and fungi love you to eat white flour, white sugar. That's what they thrive on. So that's a really important one. And then here's how the test looks again. Here's the normal flora, no growth, and of the bifidus, we want that to be a 4+, the commensal imbalance. And here's a serious dysbiotic, and this bifidus actually has anti-obesity and lipid-lowering effect. So even if you don't want to take the test, I recommend that you take probiotics in for billions of amounts, not just, you know, a couple of billion. If you go to the health food store, it's maybe 2 or 3 billion. You need 100 billion or more, you know, and vary the organisms. Get a lot of different organisms. The mycology of the yeast is a key, the yeast susceptibility. And then I asked the physicians, why do you only do one specimen? And they said, it's because the insurance company won't pay for more than one. So the reason, you know, when they're looking for parasitology, in this lab, my clients' parasites were all picked up. They did a stool swab for 5 years before that, and nothing was found. The parasites were missed. So this is important. The lab uses the type of technology in the samples that the parasites are not missed, like Blastocystis hominis can come from animals or plants, and it is a parasite, and you don't want to walk around, you know, to prevent yourself from being healthy. You need to get rid of it, and you can get rid of it using natural botanical agent. So this is great because I have a client who's got a little girl, and she just loves to be with all the animals, and this is just a reservoir of blastocystis. It's just really perfect. And these are some of the signs of blastocystis: inflammatory bowel disease, which is very serious and can lead to colon cancer. And then IBS, which has to do more with, much less serious. So it's important to know the symptomology, to know what you're dealing with, and what you want to work with. I'm going to then GI inflammation. Again, lysozyme and lactoferrin would be elevated. And white blood count, mucus, and then the intestinal health markers, red blood cells, pH, and occult blood, which is the one marker that we measure. And some of the different ideas in the secretory IgA, how it prevents the foreign invaders from coming in. And what you do to increase your SIG-A, one of the things that really helps is L-glutamine, which is an amino acid. And a bacteria called Saccharomyces boulardii, SB, is very helpful for increasing your gut immunology. And if you can tolerate whey protein, different kinds of whey protein is really helpful. So Candida symptoms, most of you have probably heard of yeast overgrowth. This test measures what kind. It measures digestion and absorption. Biomarkers, do you need pancreatic enzymes? Do you need hydrochloric acid, which most of us need after a certain age? We're not really making that. It works on that very specifically. It looks at malabsorption of fats, transit time, inadequate chewing, carbohydrate digestion, which is such a key. So, so it really gives you a sense of your terrain, which I loved from Dr. Rao in Switzerland. He always says the key to health is your bioterrain. This is one of the core aspects of nutrition, I feel, is if you have poor, short-chain fatty acids, you're not processing bacteria properly, it's going to affect your terrain, it's going to affect how you assimilate your foods and how you feel, and the permeability also. So I think most of the time the way that standard practice of medicine is, it's totally a shot in the dark. The people that come to me, they've been given antibiotics over and over again. They have never been asked, how is your digestive system functioning? This is positively identifying all of this, looking at inflammation, improving the efficacy of whatever people are doing or whatever the holistic doctors are doing. So, and all it is once a year, or if you need to retest, is this 3-day test. And as I said at the break, you can come see me, and I'm happy to go over it with you, and you can come to my office and look at it. I'm just 10 minutes from here in Palo Alto. I've been here for a long time. And it's also non-invasive, patient-friendly, and really, really great. So what I want to do, though, beforehand, before we, I wanted to work with you a little bit with what I said in the gut-brain slideshow, because many of you, were not here for that. And I just want to show the permeability. I showed that, lots of illnesses are related to the gut brain, and anxiety, migraines, autism. But I want to show you the permeability video and what it is. So permeability is when the tight junctions of the mucosa are compromised and become widened and permeable to compounds like toxins and bacteria. And that's what would affect your nutritional status. That every client I've had is unable to, has a lot of inflammation with permeability, and they have some kind of, so these are all of the symptoms. You can have any of these symptoms. You can have, a few of them. You can have a lot of them, permeability. But here is what a healthy gut looks like. I love that movie from Genova. And when you look at the junctions, look very carefully here at the junctions of the healthy gut. And then what we're going to be doing now is we're going to go to the leaky gut movie and look at what happens. So I think the most important thing for all of you is to really be aware, most people have some level of permeability. If you've ever taken any prescription drug, if you're taking any drugs, even over-the-counter Advil, if you do a lot of Advil, it's going to affect the junctions. If you're under stress, it affects the permeability. So there's so many different factors. If you eat processed food, and the foods, that's where the nutrition part, it's going to lead to permeable membranes like this, and then your entire system is one of inflammation, and that's where we saw, every single inflammatory disorder had a permeability component. So, and here's the villi, the most important thing for absorption. And so basically, what I did with these people, I just have an example of someone who was on this very serious ulcerative colitis and a lot of medications is what I did with the diet, since we're talking about nutrition, is I found that these people went off of all the processed food. Many of them were on diet sodas, went into basically, some of them did very well with steamed vegetables. It was hard for them to do, but this is where she was before. Very high stress, she had all of that. And then what happened is that after the visit, like within a year, her ulcerative colitis completely healed. And she had, when you look at the, we had the post-tests, but she went off of all the white flour and sugar. All she ate basically all day long was steamed vegetables, and she's still doing that. Steamed vegetables, raw vegetables, protein, the right kind of all organic, and then she ate the right fats. And she had, very little grain. So like with inflammatory bowel disorder, what I find really heals people is no grain at all. I mean, we've had patients just doing the vegetables, just doing whatever vegetables work for them, and protein, no grains, and the right fatty acids. We give them the particular nutrients that they need and heal the gut first, though, because this was so L-glutamine, elimination diet, the stool test, eliminating it, really supplementing with the right probiotics, aloe vera, brown rice for her. These were the vegetables that made the biggest difference. The dark green leafy, she did a lot of shakes and smoothies with vegetables. So she made a lot of that, and it healed. So we've had, I think 10 ulcerative colitis. We now have somebody with Crohn's who's doing very well with this type of approach. So, and again, 3 months off prednisone, no bleeding, no flare-ups, 100% improvement, 6% later off all meds, no more flare-ups. So we have seen, using whole foods nutrition and the supplements, an incredible reversal of inflammatory bowel disease, improvement significantly with Crohn's, and also with all of these other MS, MD, ulcerative colitis, skin conditions. She had acne, anxiety, panic, daily blood in the stool. You could see it on the test. And again, we had incredible results. Afterwards, she was completely healed. So these are just some of the supplements I want to leave you with leaky gut. I think it's really important that to both use the food and the supplements. But these are just, quercetin is wonderful, and also, as I said, aloe vera, glutamine, and licorice, and there's, they're all listed here for you. If somebody wants copies of this, you can see me at the break. And these are some other things we did with the cabbage. The okra was incredible for people. Besides the supplements, we had them do modified fasting, and these were the foods I had them eat for the probiotics. So eat, the sauerkraut and the fermented foods. I recommend, besides probiotic, that you eat kimchi and, the raw pickles. Any of these are incredible, the fermented foods, for rebuilding your intestinal tract. That's going to be very important, and I think it will make a big difference. And the same with gut immunology. We get the probiotics and re-inoculated, use strain-specific. We kept using different ones. So I think that's what I'm going to leave you with, and you can ask questions later.
Thank you very much. So I want to share a few thoughts about this wonderful presentation before the break. Just to add a little bit of my experience with regards to stool testing and nutrition. Usually people say, if they don't have enough money and they don't want to do tests are expensive. And they say, well, why should I do the test? I know I have leaky gut. I know I have inflammation. So why don't I just change the diet and stop eating certain foods and reduce the inflammation, and things will get better. And they have a point there. But most people don't have sufficient incentive to actually make the changes in the long run. Maybe in the short run, they will be willing to do something that would reduce the symptoms, but then they will gradually go back to their old ways, unless they have some black and white writings that prove that they have an issue. And that is why the tests are often beneficial. Plus, they help you hone a little more into a specific direction. You know, for example, the secretary IgA, which is very often low nowadays. I see 80% of my patients are extremely low, but 20% are extremely high. It depends on what phase of their disease you catch them at. Remember, every time you do a test, you only catch it in a single moment in time, and they are going through a process. So maybe at a certain point in time, it will be extremely high, and then gradually as their cells become tired and they don't manufacture enough antibodies, the level will gradually go down, and then we see them at the end result. So this is an important concept, and I always recommend the colostrum to help with the secretary IgA if that is a big issue. But still, you could do other things. Usually, when I see these kind of symptoms, I do the tests, but I want to start the patient right away on an oligoantigenic diet, a diet with very, very small number of antigens or foods that could lead to an immune reaction. And we know what are the top allergens or sensitizing foods. Those are the dairy, the gluten, the egg, and the soy. Those are the top 4. So we need to often just take the patient off of those, and the patient will have significant improvement. But it's not enough, because they would start eating other foods more often, like rice. And many people over time become sensitive to rice. They didn't initially, or they can become sensitive to sesame seeds or garbanzo beans, things that they think are perfectly fine. Well, they might have been fine until you start eating them every day to replace the gluten. In those situations, I do recommend to do another type of stool test. That's a stool test that looks for IgA antibodies against specific foods. And being that 80% of the IgA antibodies are indeed in the gut, you do not want to look for them in the blood. You want to look for them in the stool. Most people are being tested for gluten sensitivity in the blood, where we miss 90% of people who have gluten sensitivity. Raise your hand if you think you have gluten sensitivity. So, being that 50% of the population suffer, most of you don't know that you have this sensitivity. And if you went to a typical doctor who would do an secretary IgA test in the blood, they will miss 90% of you. If you have celiac disease, 90% of you will be missed. So I prefer to do, sometime if I have to choose between stool tests, whether I should do the digestive stool analysis that I sent to Germany or the stool antigen, it depends on the symptom. Sometimes I like to start with the antigens so that I could convince people to stop eating certain foods while also convince them what foods not to start eating or what food to rotate in their diet to avoid having too frequent of an exposure to them, because as you get exposed to them again and again, you develop some problems, which often results in asthma or in allergies or eczema or itching, digestive issues, of course, but also mental disorders, because many of those foods will lead to inflammation. So when we talk about inflammation, we want to also, besides doing the stool test, that, I mean, I see amazing results. Sometimes within 3-4 weeks, people overcome their severe inflammatory bowel diseases, ulcerative colitis, Crohn's disease, and so on. But you want to also prevent that. And when you have a 5-year-old child coming, where his parents are complaining that the child is itching like crazy all night and cannot go to sleep, and they did all the tests. They went to the pediatrician, the gastroenterologist, they did the lab test, the blood test, and they found nothing. So of course they give the child steroids and steroid creams, and it doesn't work for a long time, or for a very short term, and the child gets worse and worse. And this goes with adults as well. In that case, I could tell them, just stop eating gluten, stop eating this and this and that, and usually the child will feel better. But what parents are going to do that for a long term? They need to be convinced that their child should stop eating these foods for many years, and not just for a few weeks just to get rid of the symptoms. In those cases, especially in some of those severe situations, I find that they not only have severe gluten sensitivity and the beginning of celiac, which is caught really early before it's completely manifesting, but also the beginning of Crohn's disease. What's the main marker for Crohn's disease? Anybody? It's anti-Saccharomyces cerevisiae antibody, meaning it's the antibodies against the protein in yeast. And many people are not aware of that. If you have high anti-Saccharomyces cerevisiae antibody, that's a very clear marker for Crohn's disease, and I often find that in little children, and it's just the first sign of that disease, and nobody knows that 5 years from then or 10 years later, when they're in the mid-teen years, they might be diagnosed as having Crohn's disease. So we can actually prevent Crohn's disease long before it becomes severe, long before it becomes diagnosable, and that child will never develop Crohn's disease as a result of this simple test. So sometimes a test is necessary. You wouldn't know. To avoid yeast, you would avoid gluten, and you will eat other types of baked goods that have yeast in them, and you'll still have a problem. So you have to be aware of that. And the last thing I want to say in regard to, the last two things, in regard to this wonderful presentation, or again, thank you for that, is the M2PK test. Everybody should know about M2PK. It's a test that I do together with the general digestive panel. I send that stool to Germany because they count the exact number of microbes instead of eyeballing them. But more importantly, they also do the M2PK test, which tells you if you have the beginning of colorectal cancer. So you're not just thinking about the threat of cancer, but you want to know, because inflammatory processes in the gut almost always lead to colorectal cancer, which is undiagnosable until a very late phase, until you have actual ulceration. So the M2PK test is a very simple one. Statistically speaking, in the last 12 years that I've been doing this test, I've seen maybe 300 people who had a positive finding, meaning they already had colorectal cancer. 300 out of maybe 1,500 that I've tested. So it's maybe 20% of the people that I test. And I, of course, select people for the test, so they already are more predisposed. They are people who have significant digestive disorders, so we are more likely to find this with them. And this test is far more accurate than colonoscopy. And you can find the cancer so much earlier. So I do it together with a panel, because then I see the result of the inflammation. If the inflammatory markers are up and there is cancer, all we need to do is treat the inflammation and reduce it. Oftentimes, I test for something called histaminosis, histamine level in the stool, which doctor's data unfortunately still does not do, but that is such an important component. And when does histamine level go up? When you have food sensitivities. Also, some endotoxin, mycotoxins can lead to elevated histamine, but histamine level goes up when you eat the foods that are containing probiotics. So you have to be cautious. For some people, eating a little probiotic food, kimchi and etc., will be perhaps beneficial, especially on a temporary level, because those are not exactly the microbes that colonize the human gut. They're slightly different, the ones that ferment foods. But people who eat fermented foods like kombucha have the highest level of histamine in their gut. And the first thing that I have to tell them is to stop having all fermented foods. So you see, it's very individualized. And that's why it's so important to test for histamine, because otherwise you don't know and you will keep eating all those fermented foods in huge quantities. Now, go back to nature. Does nature allow us to eat a lot of fermented foods? In nature, what would you do when you smell something fermented? You'll turn away. You'll run. You will definitely not want to eat it because it's spoiled. When did we start eating fermented food in large amounts? North of the Alps, because we need to have a source of calorie when there was no food. So you had to spoil food enough that it cannot spoil any further. Then it could last a long time. So many countries have become accustomed to these foods, and they are traditional now. We call them traditional foods. But they are very short tradition, because we haven't been in Europe that long as a species, only about 25,000 years. not enough to make significant changes in our genetics, in our physiology. So we eat certain things that allow us to survive, but there is a slight risk. And we see that in many patients who have severe level of histaminosis. Just for your information, 10 years ago, histaminosis level was very low when I tested it. On average, it was 300, 400 units, but now I see a lot more reaching the top level of the test, which is 3,000 units. I see a lot of people with 3,000, and in the last 2 months, the lab had no choice, that German lab, but to increase the range, because 3,000 was becoming so common that they had to extend the range of testing. And now I see people with 11,000, with 20,000, and even 28,000, and one patient with 33,000 units of histamine. That is such severe level of inflammation that we have to be aware of it and stop it. And there are several things that you can do to lower histamine besides the diet, but the diet nutrition is extremely important, and avoidance of the allergenic foods, where that other stool test can become very important, because now that you have a proof that you have severe histaminosis. And out of those 300 people that had positive M2PK, you probably wonder what's the fate of those 300 people. Because we caught it early, and because the turnaround time for the cells of the gut is extremely rapid, you probably know that the whole cellular mucosa replaces itself every week. It doesn't take too long to heal a gut problem if you eliminate the causes. So out of 300 people with positive M2PK, people who were so worried because they started having their cancer. And you might say, why should I even let people know about that? I should just treat them and they will prevent the cancer. Again, they need conviction. They need to know that they have something that would make them change, because many of them are people who would not change their diet, will not change their nutrition, but when they see a positive M2PK, they pay attention. They want to stop this thing in its tracks. 300 out of 300 within 3 months had negative M2PK test. It's that easy to reverse M2PK finding and get out of the throes of colorectal cancer if you catch it early. So early detection in this case becomes prevention. And that is what I wanted to add to this stool discussion and digestive discussion. I really thank you for bringing it up. And before we take the break, I want to first thank Anna for all the work that she's done with regards to the special, the really special event that she's holding in a week and a half on Saturday. She's so selfless and so altruistic, and she truly is doing it for the children. And I think there is no better way to make a difference in the future of another person is to have a child that would be thrown away, that would have a horrible tragedy for life, and to make sure that this child has a nurturing upbringing and love and affection and education that would last with them for life, that would bring them to a sense of abundance, so that we can really leave a legacy of humanity that we can be proud of. There's nothing more important than helping a child avoid this horrible fate of trafficking. And the more important aspect is that we could teach the whole world how to raise a whole family of children, hundreds of thousands of children that are healthy, that are not suffering from ADD and ADHD and autism and the whole spectrum and digestive issues and obesity and cardiovascular disease and cancer in early age. We can prevent all that by catching them early before they are exposed to all the things that destroy their gut, like the chlorine and the fluoridation of the water, which they destroy the digestive tract. And you need to avoid those things in the water. People drink water all the time with both items, and those children are not doing it because they're not in a developed country. So they're not exposed to fluoridation in Nepal or chlorine in the water. And they're not being excessively vaccinated 35 or 36 times before they go to first grade. And they're not exposed to electromagnetic radiation of all the types that our children are exposed to from Wi-Fi in the schools, which destroy their fertility. When they work with Wi-Fi, children should not be exposed to Wi-Fi. And the school system is full with that. So if we do things differently, and we can prove that a whole generation of children, once we get to 100,000 children in Nepal instead of 3,500, that's my goal, to get to 100,000 children in our network. That will be a country. That will be the first time in the last 50 years that we in the West can have a control group. A control group to study against our group of children, which cannot serve as control group anymore because everybody in our country is exposed. You know what I mean? Everybody here is exposed. You cannot find a child anywhere who's really not exposed to the effects of modernism that we have created. So we need a control group to prove the difference. So maybe from that we could learn how we could change what we should do here. Maybe it's a lofty plan, maybe I'm just deluded, but I want to try. We have to give it a try because otherwise there's no hope when I see what's happening with the children in our country today. So I really appreciate it if you do join us on our special event on that Saturday and share in the doing, and come to Nepal and come foraging and come trekking and see what there is out there for you to fulfill your destiny to do good. And really last thing before the break, I want to the salt will later after the break. I mean, I'm still the moderator, don't worry. The important thing here is I really wanted to, in honor of Steve's wife who passed away not too long ago, Anne. I don't know her much. I just saw some pictures that Steve sent me after she passed away. And then I found out with great pleasure that she left behind this musical instrument that she obviously loved to play. And it's one of the instruments that I happen to play as well. So I will just give you a very short melody in honor of Anne. Let's have a break.